when something's wrong but nobody else sees it. In the medical sense, is what I'm going to talk about today. So, I think this must happen very commonly. As a doctor, it's a little bit different because you have a little bit more medical knowledge. But for many patients, there must be times you go to see doctors and you're like, no, I know there's something wrong. The doctor, no, no, you're fine, right? I mean, I remember a friend telling me, he's like, yeah, I just have this chest pain, and the doctor just keeps writing me off. The doctor says, oh yeah, you're fine. Oh no, it's musculoskeletal costochondritis. And so yeah, it's costochondritis. Inflammation, those I guess muscles connections with your ribs, chest, blah blah. So when you breathe, it hurts. That's why your heart's fine. I know I didn't look into it, but your heart's fine. Your lungs, yeah, I know I didn't look into that, but your lungs are fine. Don't worry about it. Just take some ibuprofen. That'll take care of it. So he took the ibuprofen and he's better. And he comes asking me, so the conclusion is I'm just a drug addict for the rest of my life? Like, he really wants to know what's wrong with him, right? Where did his costochondritis come from? What does that mean? I mean, I've never had this before. He was in his 30s at the time. It just happened suddenly. So let me talk about my personal experience this past week with my ear. So, I know a little bit about the ear, given, I'm a doctor, but there's many reasons for ear pain, and I've had ear pain, right? But if you look at all the studies, and again, because I'm a doctor, I believe them, my ears are fine. My left ear hurts. But I saw somebody who cleared my earwax out. You heard a little bit after that, right? And then I saw an audiologist to do a hearing test. I have normal hearing, which apparently actually means good. I guess most people don't have normal hearing, so normal is good. Anyways, so she did a test with some puffs, right? She said it's like, when they measure your eye pressure, tonometer, the optometrist, there's a puffs. And she said, yeah, your eardrum moves very well. It's perfect. Don't have fluid behind, because you have fluid behind, it wouldn't move very well, right? We might see a sucked in look or something, or a swollen look, right? And so she said, it looks perfect. So I didn't have ear pain a week ago. I think I have ear pain. It did hurt a little bit after the ear cleaning because they spray water pretty hard, shall we say, forcefully. But I did have ear pain after I went to the audiologist, but they stick stuff in your ears, and I know if I stick stuff in my ears, it doesn't feel good. And then afterwards, it starts hurting more. Not throbbing, but more sharp. I was like, could it be like an ear canal, my nerves, because they stuck stuff in, it's irritating my nerve? Is my actual eardrum? It's very hard to distinguish sensations in our ears, where it's really hard for us to tell where it is, what it is. I had another doctor look at it, she said, looks fine. And then I had another doctor look at it, who also said it looks fine. So I'm pretty convinced that my ear is fine from the infection perspective. I don't think my ear is filled with fluid, but I don't think my ear doesn't hurt, because I know it hurts. Now the question is, what do you do about it, right? The first thing is, do you trust these people when they say you're fine? Because what does fine mean, right? I think that's a difficulty, because when they say fine, or when a medical professional says fine, it means that there's nothing serious to worry about. It's not going to get worse, and it's not like something like cancer, and not like something life threatening. So that's what fine means. But it doesn't mean you feel fine, right? So you can say you'll be fine. It's just a cold. But it doesn't mean you feel good, right? Or you'll be fine. It's not COVID. It's just the flu, or whatever term you want to use. Fine doesn't mean feeling fine, right? My mom had a cough for 3 months. She went to see lots of different doctors, and they said, you're fine. She says, what's wrong with them? I'm not fine. I'm coughing all the time. It's like, yeah, well, I would say they're both right. I think they're just having different meanings of the word fine. Fine as a doctor to doctor, right, is the patient's fine. They're not crashing. They're stable. They're not going to die. That's something that's good to know as a doctor, right? But when a patient says I'm fine, it means I feel good, right? Sort of like hearing test, normal, good, right? Because I actually have very good hearing for somebody my age, because I haven't had hearing loss really. But it's called normal. They don't say the word good, that's not in their vocabulary. So going back to this idea of my ear, I mean, I could think of different reasons why my ear hurts. The thing is, it could be subtle, as in something to a significance level that doesn't rise, that it changes what they could see, which to my medical understanding means it's not actually dangerous, not worrisome, it's going to get better. But it's not fine for me as a patient because my ear hurts and I want to go away. So, what do we do about it? I think that's the difficulty, right? I don't think doctors are trained to make people feel good. Doctors are trained to deal with illness. We call it pathology. We're trained in pathophysiology, how the body goes wrong. But when the body's fine, when nothing's that out of whack, what then do we do? How do we make you feel better? And that's where I think the whole over-the-counter comes into play, right? People try all these things, do all these things, make them feel better. And you go to the doctor and see what they could do to make you feel better. But I think realistically, oftentimes it's less than fruitful. And if you could put up with it, just put up with it, because you'll be okay. You just have to get through it. Believe the doctor, you'll find, and you'll feel better. That's what I'm trying to do. And it's working because my ear feels better.